So with the upper leg, femur is the main bone, really big, long bone, runs all the way down the length of your thigh. Should be a little bit more towards the center. Sometimes you can feel this through the quads, sometimes you can't, depending on how tight the muscles are. The trochanter on the outside is very important. So this piece here is this bone right here. Bothers me a little bit watching hockey playoffs when they always talk about the hip check, and it's actually a greater trochanter check. It's not the hip. The hip itself is more this region in here, the actual joint. This is actually part of the femur bone. This is where a lot of muscles attach, which is why it's so big and bony and strong. The neck of the femur is really important right in here, this tiny little piece that goes from the trochanter into the actual joint where the ball and socket actually connect. So if the neck ever gets broken, it's a really big deal, and or quite often that's what they work with surgically. The actual ball and socket joint is literally a ball and socket. The ball of the femur fits into the socket of the hip, and it should rotate, spiral, move in and out, and do lots of good things. So whenever we do abduction groin stuff, adduction in, flexion, extension, and even some rotations, there should be lots of mobility in this joint, and it tends to get a little tight because we spend too much time sitting in chairs. So the trochanter should be spiraling forward a little bit anterior or internal again. That's actually what creates the majority of the internal spiral down through the rest of the leg. So when you're standing, you should think about your trochanter coming forward a little bit rather than backwards, which tends to push the belly out, splay the feet, etc. Things we'll talk about more later. So remember, the head of the femur, the actual joint, is by these bones here, which we'll talk about in another video around the hip, but the anterior superior iliac spine, ASIS. And so if you go from your ASIS in your hip directly down, this is actually the hip joint, way in here kind of by my pocket rather than out here by the trochanter. Remember, this is a bone of the femur. Femur comes down, joins primarily the tibia to create the knee joint, which we'll talk about separately as well. And this big long bone, femur, trochanter, neck is good to know. Head is important too, and it plugs into the hip joint, which is in the hip joint, not on the outside.